Just a little bit about InnoScot. I'm definitely not the founder. I'm old enough to have been the founder, but I definitely haven't in that capacity. We've been going as a company under the original name Scottish Health Innovations since 2002, and have a unique role in being focused on commercialisation of ideas that originally, in our original guise back in 2002, there were ideas that had emerged directly from the NHS. More recently, we've also recognised, importantly, that collaboration is the name of the game. So we do now have the capacity, and we do extensively work with academic entrepreneurs and partner with industry as well. And I'll talk a little bit about that as we go through the session. We last year we thought it would be quite a helpful exercise both for ourselves and for policymakers more generally to do some work and look at the state of entrepreneurship and the state of innovative capacity within the NHS. And we commissioned a survey, an independent survey, to try and answer some questions around the level of support for innovation that existed within the NHS in Scotland. And so, as you can see from this slide, a huge proportion of staff that we surveyed did believe it was an important element of improving services here in Scotland. And more importantly, in some respects, a large number of people who actually are motivated to propose new ideas and see themselves as innovators, not just to make money. And indeed, the idea of an entrepreneur being financially successful, really was very low on the radar as far as why they were interested in innovation. Sorry, I jumped on that by mistake. So yeah, the majority of people doing it because of patient benefit largely, and in some measure also to drive efficiency within the service. Just a little bit about us so that you can see where the connections with academia and innovators and entrepreneurs more generally operate. I'll take you through a little bit about what we actually do in terms of working with entrepreneurs. It's all very well to have an idea, but of course, how you take that idea, how you work it through both the development pathway, through the funding pathway, through the regulatory pathway, is complicated to put it mildly, and certainly in life sciences and healthcare generally, it can be quite slow as well. And show some examples of some of the time spans that we're talking about later. But it's very helpful. It's been very helpful over the last 20 odd years for colleagues within the NHS. And I should have said we are funded by the Scottish Government primarily in InnoScot, so we have partnerships with every health board in Scotland. But we provide that independent advice and support throughout the whole pathway of idea development, and that's really important to entrepreneurs, so they have access to people who've been there before, who understand some of the typical pitfalls, and are able to give support and guidance through what is always a pretty challenging and inevitably cyclical pathway from idea development until commercialisation. But over the years, we have added value in numerous different ways, whether it's just through the level of advice we give to colleagues within the health service across Scotland on an annual basis, or whether it's through spinning out ideas into companies we've set up and partner with funding sources in Scotland and generally, and also in terms of license deals. So, there's different ways of being an entrepreneur. It's not just about setting up your own company. It can be about taking the idea and, as I say, ending up with some form of partner arrangement with an industrial partner. And we've obviously been able to do that in many different cases over the years. Just a couple of 2 or 3 examples just to show you the sort of things that are happening around where partnerships and collaboration between health professionals, between academia and industry partners and funders are important. Aurum Biosciences is a spin out from NHS Greater Glasgow and Clyde. Again, a company that has been around now since, I think the spin out was probably in the early part of 2015, but really some very novel technology and very novel indications that the Aurum range of innovations can tackle. And we've raised money internationally for this company over a period of time now. While it was originally focused on, and still is primarily focused on stroke care, there are many other relevant indications, as is alluded to in the slide. So a really good example of a clinician who had a contract with the University of Glasgow at the time, coming to us and having a pretty raw idea, had some connections, some important connections, and we were able to bring that idea through the development pathway and then spin it out, and now sit at the board and, as I say, continue to work to see, I think, what will be a very significant exit at some point in the next few years. Again, another one where we've been involved for a long time, but important. This is an idea that came directly from a clinician, a cardiologist, originally working with, again, Greater Glasgow and Clyde. Of course, that service has now moved over to the Golden Jubilee Hospital, where he still works. And again, a company that over a number of years has built up a very strong intellectual property portfolio, regulatory approvals across the world, and we've continued to be involved and supported. But everything we do is not at that, let me call it perhaps, more technical end. Some of the projects that we get involved with are relatively simple in concept, but still have massive patient benefit. And this is one of the better examples. Again, originally developed in partnership with an A&E nurse in Lanarkshire, and again from some very rough drawings and a kind of idea that it was important to find more effective, more reliable methods of weighing patients, particularly in accident emergency. A simple idea: you take something that's already used, a patient slide, and you incorporate effectively scales within it. And again, this is an idea where we partnered up with a company based in England, Marsden, a specialist in weighing technology, and again, we now have this product in hospitals all across the world. Through COVID, we developed this again in partnership with colleagues in NHS Tayside and commercial partners, moved it forward very quickly through the trials of that particular period in time, and actually got something through the process, the development process, commercialization process very quickly. And that's something that COVID was, I think, really helpful about, was again energizing speed of development and willingness to perhaps adapt in ways that would have been harder to envisage beforehand, and that applies through the whole regulatory pathway as well. Things have definitely are now happening in a much more accelerated time frame, which is really helpful when you compare, as you've seen from a couple of the earlier slides, some quite long pathways to successful exits. So just again, InnoScot, as I said, we are in that position of taking your idea and working it through to commercialization, and we work with colleagues across the health service in Scotland, as well as entrepreneurs, innovators, whether they come from university and academic environments or industry. And we have good collaborations. One of the things that again, we've spent a lot of time investing in the last couple of years, which is really important in bringing successful ideas to market is regulatory advice. And we have at least one of the leading experts in Scotland in our team, Elaine Gemmell, and we're really providing a very important service, because there's no point having an idea if you can't actually get it through the various regulatory hurdles along the way. So over the years, there are a few things that I would say we've learned as a team, and I've certainly seen in both in InnoScot's case and before that in other industries that I've been involved in. I think it is worth thinking about them as you have, or you're in contact with people who have ideas. It really, clearly, it's important that the idea itself is robust and can be protected. A lot of the time, it's the intellectual property around it that is one of the most valuable features for investors if they're coming into a situation where there's perhaps no revenue, no track record of success. You need the time to develop the idea, and that's one of the things that emerged from the survey that I talked about earlier on around NHS colleagues, whether they see themselves as being innovators and wanting to be innovative. Sometimes the challenge is freeing up enough time to actually work in the project. Now, we can take a significant amount of load off, but if you don't have an engaged entrepreneur working and giving his or her time to the idea, it becomes a lot more challenging to push it through the pathway that we have. So the nature of support within the organisation, if you're working within, whether it's within the health service or even within academia, having senior team support for the amount of time and the challenges that you will inevitably have is really important. Clearly, funding. There's never enough money to go around. It's never easy to raise money for ideas, whether it's grant funding or through early stage high net worth individual funding or through partner funding. I mean, there's no easy solution. There's never an overabundance of funding, but nevertheless, it's pretty safe to say that if the idea is strong and the team is strong behind it, then with the right support and guidance, it should be capable of being funded. But equally, a lot of the time we have an individual that comes to us with an idea, particularly if you're looking at the whole spin-out route for entrepreneurial success, having that ability as someone who's passionate about his or her idea to recognise when the team is perhaps, you need to build a team, you need to build skills around you that perhaps you're not as comfortable with, is really an important inflection point, and something, again, having someone like yourselves alongside kind of recognises that challenge and can introduce colleagues to the opportunity, I think can be really quite helpful. Throughout the entrepreneurship journey, you're going to need advice from many different professionals, and so surrounding yourself with the right team, whether it's in our case with the health service, through the colleagues in InnoScot, or more generally through any of the accelerators or incubators that are around, is really important. And these final points, it's pretty hard to see ideas succeed where the entrepreneur behind them hasn't shown these particular four characteristics. Just an example of what we're doing currently, and we do push calls out for innovative ideas. We have one just now for people who've got sustainability ideas, and we're always anxious to get ideas to consider and whether we can support them or not. But one of the things that's quite attractive has been recently an innovative program that was started south of the border, but colleagues within InnoScot, Gillian who's here today, I see her somewhere in the audience. Julian has been actively involved in bringing the clinical entrepreneur program to Scotland, and again, a very important way of attracting colleagues within the health service who want support and who've got good ideas into a more structured environment where they can collaborate with others who are at a similar path of the journey. Has been really quite helpful, and as you can see from this slide, some good outcomes already nationally within the UK that have been developed. So we're delighted to be part of that programme and have got a number of entrepreneurs that are working on the Scottish cohort currently. That really is a pretty rapid run through, probably run over the time that Alex wanted me to speak for, but if there is anything that we can do for you or advice that we can offer, we don't charge for it. The way we're funded allows us to structure our services in a way that is not prohibitive for folks that have got good ideas. We're always open to conversations, and hopefully we'll have some of these as a result of today, but I appreciate your listening to me and happy to answer any questions that you might have.
Thank you very much. Are there any questions for Graham? Can you put your hand? We've got cameras on.
Thank you. Lorna Jugate from Opportunity North East and One Dialogue. I've had conversations with a number of clinicians that have innovative ideas, and one of the things that puts them off is that, well, there's two things. They don't see themselves as entrepreneurs, and they don't actually want to take the time out to develop it. They want to see it through to market, but somebody else to do it for them. And the second thing is, they're reluctant to get involved in anything that they don't think they'll ever be able to use because of the complexities of the procurement process. Have you got any sort of recommendations on how we to overcome those issues?
Good question. I think hopefully the survey that I referred to perhaps showed that when probed a little bit further, more people than you think see themselves as innovators. So there is no doubt, though, that as I said in the presentation there, that if someone can't free up the time, doesn't have the enthusiasm, doesn't have the confidence to stay with the idea, it can be a little bit harder to bring it through the pathway that we typically have. So I do think it's something where there is benefit again in engaging in the dialogue, so that again we can perhaps find sometimes it can be partnering someone up and finding another colleague who can work in the project. So I do think that it is can be quite important.
I think there's an interesting use of language, actually, to your point, Lorna. Entrepreneur is sort of up here somewhere, isn't it? Whereas all the way through your presentation, Graham, you talked about ideas and innovation and bringing ideas to the table. So I wonder if there's a language thing, and I wonder if that sort of entrepreneurship term is maybe quite an I guess it depends what the objective is. Do we want loads of companies, or do we want innovations, and do we want solutions? So that's a really good shout, Lorna, but maybe we need to check in the language as well. Any other questions for Graham? Yeah. And there's one back with David, and then we've got Carol here.
Hi there, thanks very much. David Ridd from Valneva. I used to look at Edinburgh Bioquarter, so I know all about innovation ecosystems and working with the NHS, but you mentioned about the time required, or that kind of ring fencing of time for clinicians to do this. Whose job is it to make that happen, and how important is it that is put in place?
Thanks. Yeah, well, it is important to make it happen. And of course, as I said, if you don't have senior leadership in the organisation that's supportive, it can be challenging. but again, it's something that we've tried to do on occasions where we've been working with someone. The Orem example that I cited was an example of that, where we could see that there were challenges where some individuals perhaps in their normal reporting lines there wasn't the kind of support they needed, and we were able to help in that. We're quite fortunate, as we're a relatively small company. We do on our board have the research and development directors for all the big health boards, so our ability to get out and affect change is possible, but it is important to free up the time. I apologise, I didn't answer properly the second part of the first question, which was the pathway. And again, procurement is an issue, but there's a lot of effort in Scotland just now to streamline procurement approaches and make it easier and make the pathway easier. There's still in whatever language we want to use, but in the innovation space within healthcare and life sciences in Scotland, if there's one criticism that we would have, is it's still quite cluttered. There's a lot of different organisations that play a role. They're all playing an important role, but there's ways in which, for those on the outside looking to navigate that, it can be quite daunting at times. So again, ways in which, partly something that we try and do, but it's an area where there could still be, I think, some improvements in streamlining that.
Thank you.
Hi, Carol Rafferty, Den Therapy here. I'll not storm the stage with our new oral care product, but you mentioned that you welcome people outside the NHS to come and speak with you. Can that be at various different stages of the process, with the technology to, getting it to market, or
yeah, it really can be. And the point that's important is that the NHS is a huge asset. I mean, there are thousands of people in Scotland working in the service. There's tremendous skill sets, and there's tremendous appetite for innovation. So if the idea is being developed outside but could be improved or could be accelerated or could be supported by partnering with suitable professionals within the health service, that's something that we think is really important to do. So we definitely look at that, and I would say now, we get over 100 new ideas every year, and we have done over many years. So there is a lot of good ideas coming out, but quite a growing proportion of the ideas that we kind of look at seriously now have some external component. So I think that, and it's being pushed in from a policy perspective, obviously, the importance of linking up the NHS with academia, with industry. We're totally behind that.
Thank you very much. So I'm just going to sort of wrap up and say thank you very much, Graham, for giving us that overview, sharing your insight from your experience, and also reminding us that there is this tremendous opportunity from within the system, the people who are at the coalface, the people who have that direct engagement with patients. They understand the patient pathways inside out. There's this amazing opportunity to generate ideas and innovations from within. So thank you very much. If you could thank Graham.